Hello, my name is Dr. Maran Chaima. I'm an orofacial pain specialist at University of Minnesota. I realize you might not know what's orofacial pain. Orofacial pain is a new specialty in dentistry. It's just been recognized in March 2020. It's dealing with whatever pain you have in this area, whether it's pain for dental reasons, muscle pain, jaw pain, pain similar to headaches, pain because of some nerves or some syndromes. Plus, part of it is regarding sleep dentistry. Let's talk more about the relationship with headaches. There is a great connection between jaw pain and headaches. Why is that? Because both of them are affected actually by the trigeminal system. It's a big nerve in this area, in the face area and the head. They have found that patients who are having headaches are much more susceptible to have joint pain. That can be because patients who are having headaches usually have like central hypersensitization. Their brain is very sensitive to anything, which might lower their pain threshold. They have more pain in general. And more than 50% of the patients who are having jaw pain, unfortunately, they also suffer from headaches. And once the jaw pain comes with the headaches, they start triggering each other. Jaw pain can trigger headache, and headache can trigger the jaw pain. Also, patients who are having chronic pain in general are having more emotional tension. They might develop more parafunctional habits. And generally, when we are having pain, we tend to hold the tension in this area. Also, some of the medications patients are using, like some of the antidepressants, have found to increase the patient clenching, grinding, and jaw pain as well. How do we diagnose jaw pain? From the history of pain, is your pain constant? What type of pain is it? Is it like a dull, achy pain, sharp shooting? If it's a low-grade one or a moderate one as well, usually, of course, it will be in the face, in the jaw, in the temples. Some people have it in the neck or the back of the head. It's triggered. Triggers can be stress, choking, eating. And for some patients, it can be social interactions. How is it relieved? It can be relieved by ice, heat, non-steroidal anti-inflammatory, Tylenol, narcotics. All these can relieve the jaw pain, actually. It can be associated with jaw noises like clicking or rubbing, inability to open the mouth completely, or locking episode, jaw locking episode, teeth pain, ear pain, sinus pain. Bite changes, you don't feel like you are biting the same way that you used to. Your pain can be worse at the beginning of the day or the end of the day. What other questions do we ask? We also ask you about your habits. Like, when did your facial pain start? Do you remember how it started? Do you think you clench your teeth? Do you clench your teeth when you're awake? Do you think you do it while you're sleeping? Both. And usually when I ask such a questions, I am looking at the patient temple area, because patients, when they are having some habits, they are just doing it subconsciously. So I can recognize when I see their temples are contracting several times. Do you chew gum? Do you bite your nails? Do you chew a pen? Do you have always something between your teeth? Do you think you bite your lips or cheek? I'm not talking about accidentally. I'm talking like when you are stressed out, you start biting your lips. Do you chew on both sides? Because that's the normal. If you have a preferred side, that might also induce jaw pain. What's your usual diet consistency? Do you usually go for soft food to avoid hard food because hard food is painful? Or are you like eating a lot of crackers and snacks and sticky food like toffees? What do you prefer? And then when I start doing my examination, I will start first by observing what the teeth look like. Like normal teeth is supposed to have different heights, and there's like this translucent part of the teeth. On the other side, if the teeth, there's attrition and the patient have been grinding their teeth, you feel like the teeth has been cut by a sword. It doesn't have different heights, it's just one height. To be fair, some patients, their grinding doesn't show on the anterior teeth. It shows more on the posterior teeth. So I'll also have a look at the posterior teeth. All the posterior teeth are supposed to have like some cusps. If I don't see these cusps and I see more of like yellowish spots, that means that the enamel layer, which is the first layer of the tooth, has been worn down. And now I'm looking at the second deeper layer. I also look at the cheeks. The cheeks are supposed to be smooth. If there's this line, and this line actually indicates where the upper and lower teeth meet, where you might be biting your cheeks, you might be just holding a lot of tension in this area, so you're squeezing your cheeks inside. I might look at the tongue. The tongue is supposed not to be scalloped. If it's scalloped, it can indicate several indications. One of them can be that the patient is pushing the tongue against the teeth. They are holding a lot of tension. It can be clenching. It can be large tongue. It can be a lot of stuff, but also it can give me an indication about your clenching habit. How are you opening your mouth? The normal opening is to open in a straight line. If when you are opening, you are deviating one side and then going in a straight line again, there might be a problem. If you are opening and just deflecting to one side, there might be another problem. It indicates some problem of the joint, and usually it's a mechanical problem. And then we start doing our examination. We start with the TMJ palpation. We start palpating on the TMJ. We'll have our fingers in front of the ears and ask you to open and close several times. Why is that? I just want to locate where your joint is. I can feel it under my fingers. And then I'll apply pressure to this part while you're opening and while you're closing. And there's not supposed to be painful, but if it's painful, it indicates that there is problem here. There is a TMD, temporomandibular disorder. Also, while doing that, I can start examining the joint noises. Normally, there are not supposed to be any noises. But if I can hear or feel a click, so that means there is a problem with the disc where it's between the joint. Or if I start to hear a rubbing noise, it can be some sort of arthritis, actually. Also, if you are having any limitation in mouth movement, you're not capable of opening your mouth, probably you're not capable of pushing your jaw to the right side, to the left side. All of these indicate some problem, whether the problem is muscle related or it's joint related. Then the muscles in this area is very interesting. For example, this muscle here, I'll ask you to clench your teeth and have your fingers here. You can feel this muscle contracting. This muscle is a very powerful muscle. It's called the masseter. And unfortunately as well, it refers pain to the cheek area. I don't know if you have ever had like your headache starting on this area. It might be actually because of this muscle. It also can refer pain to the upper teeth. The same muscle have another fibers that are running deeper. This muscle can refer pain to the ears. And that's why a lot of time when patients are having jaw pain with the muscle pain, it can be referred to the ears. Then this muscle, it's a big muscle. Most of people have their headache starting at the temples. This muscle refer pain to above the eyebrows. Also, some patients get their headaches in this area. So if this muscle is spasmed, it will refer pain to these areas. The normal for these muscles are to be used only when you are eating or talking. Other than that, these muscles, which are responsible for the jaw closing, are supposed to be relaxed. And like any muscle, if they are supposed to be relaxed, but they are not relaxing, it will spasm. If you train a muscle a lot, it will just spasm and start sending pain signals, asking you to stop whatever you are doing. These muscles do the same. And sometimes we just translate this pain into a headache, and it triggers a complete full-blown migraine, actually. Other muscles that can also affect our pain are the neck muscles. Like this muscle, actually, it refers pains, again, to above the eye and the ears. And then the trapezius, it's a big muscle. We all know we hold a lot of tension in this area. Also, it can refer pain starting here, going to the temple, at the end of the jaw, can be from these muscles. Why? Let's talk about this muscle first. Another muscle is at the back of the head. It can refer pain to the top of the head. Again, some of the patients get their headaches at the top of the head. Why am I talking about the neck muscles? It's very well connected with the jaw muscles. I usually say muscles talk to each other. If these muscles are in tense mode, most probably these will be in tense mode as well. And these muscles are usually associated with posture. Generally, the head, how the head is postured. And we'll talk more about that. How to treat jaw pain. Treating a jaw pain, it's not only giving medications. Any medication has the side effects. So usually it's a lifestyle modification, the same way we treat a headache. And the first step of lifestyle modification is awareness. I want you to be aware of the habits you are having in this area, whatever the behavior you are doing here, whether clenching, grinding, just holding tension in this area, it affects the complete system. And doing a behavior a lot, it starts becoming a habit. Meaning you are subconsciously doing, you don't mean to do it. To break any habit, you want to get it out of the subconscious level to the conscious level to be able to control it. So, first of all, awareness, and then I want to replace it with another habit. What's the other habit I would like to suggest is relaxing the jaw area. I know, easier said than done. So how to do it? We say tongue up, teeth apart, jaw relaxed. How to do that? Remember saying letter N. Always I go for an N. When you are saying N, your tongue is up, teeth are apart, and the jaw is somehow relaxed. But I don't want the tense and like, no, it's just a relaxed, and like in meditation when they go saying, just to relax everything. And please check for your posture, especially individuals who are having desk jobs. We always start our job this way and we start leaning forward. So always remember, shoulders down and tuck the chin. And jaw pain in general, I can need to refer you to a psychologist. Every one of us, the modern life is having a lot of stresses, and we don't want the stresses to affect our body. Then self-care, some simple self-care instructions. You will start with, first of all, heat and ice packs. Heat and ice packs, you can do it 2 to 4 times daily, whatever you prefer. There's this, it's called face or head wrap. You can find it online on some stores. It's just a long wrap, and you wrap it around your jaw, where these muscles, both these muscles, are having some of the heat or ice. And it comes with a pack. This pack can be microwaved for hot packs, or it can be just thrown into the freezer for ice packs. After that, Why don't you massage these areas a little bit? This muscle, it starts from the cheekbone, ending at the end of the jaw. Go all over the muscle. And then this muscle, it starts here, going at the end of the head. Also, you can massage these areas a little bit. I sometimes suggest using the face wrap or the head wrap, wrapping it around the neck if the neck pain is also prominent. While doing the massage, you can do the massage with Voltaren gel. It's just over-the-counter gel, which can reduce the inflammation a little bit. Please avoid wide mouth opening. You don't want to overstretch these muscles. Try to chew on both sides, and I prefer you go for a pain-free diet. I'm saying pain-free diet, not soft, smooshy diet, because I still want these muscles to work a little bit. But whenever you're eating anything and you feel like it's too much to chew, please stop for some time. Again, these muscles have been working for a long time if you're clenching or having parafunctional habits, and now they are much spasmed. If you're having a leg cramp, you'll never go running for a marathon, right? It's the same for these muscles. And let's try to break your parafunctional habit. It will take time. It took time to build this habit, and it will take some time to break it as well. Why don't we wear a rubber band around the hands, and just when you start feeling that you're clenching your teeth, holding tension, whatever, just snap the band, just as a reminder. You can set some alarms on your phone to just check the posture, make sure your head posture is on the right side, make sure your jaw is relaxed. And there's also apps that can help you with that. They also send you random reminders and just telling you to breathe and relax. Let's have some exercises. I will ask you to do each of these exercises 3 times daily. First of all, remember when you were saying N and you had your tongue in the roof of your mouth? Stick it in the roof of your mouth and start opening and closing without the tongue leaving the roof of your mouth. Please do this exercise like 10 times, 10 repetitions. There's another variation of the exercise, just having one finger between in front of your chin and the other over the jaw, and also start opening and closing without tongue leaving the roof of your mouth. The other variation is just to prevent the jaw from posturing forward, and it's here for you to feel how the joint is rotating under your fingers for like a biofeedback. And then some resistance exercises where you will try to open your mouth while having 2 fingers below your jaw, try to close while having 2 fingers above, go to the right, go to the left with some resistance. Another exercise, I'll ask you to have 1 finger between your teeth. Don't bite over it, have it loose a little bit and hold it for like 1 minute and then relax. And then have 1 knuckle and then relax. Have 2 fingers, relax, 2 knuckles. I'm just starting to stretch these muscles, but really slowly. Finally, just a simple exercise for your back, where you stand by a wall and you try to have your shoulders back. The head is also touching and tuck the chin. We might need to refer you to a TMJ physical therapist. Physical therapy is amazing with the jaw pain. You can also ask your dentist to have something between your teeth, which is a splint, a mouth splint. First of all, it's protecting your teeth from all this clenching or grinding, so you don't have these wear marks on the teeth. You only get 1 set of teeth per life. What type of splint you can use? I prefer using a flat plain one, as if you're biting equally all over. Also, it forces you to go to the end position where the teeth are slightly apart so the muscles are more relaxed. I don't prefer the small thin ones. I also prefer a full coverage covering all the teeth. I don't prefer biting only on the anterior teeth, the small ones, because it can cause more wear to the anterior teeth, might affect the anterior teeth, change your bite, causing some open bite. I also prefer the hard custom-made one, I don't like the soft, ready-made ones because they are not really done for you. I want one that is really done for you by your dentist, where you are biting equally all over, so it's not affecting your bite as well. And please regularly check your appliance with your dentist. By time, the wear patterns can be different, and it can also affect how the appliance is balanced in your mouth, and that would affect your jaw as well. We might do some procedures like trigger point injections. We follow the consensus by the American Headache Society for doing the trigger point injections, where we locate the trigger point and start injecting a local anesthetic solution. After doing that, we use spray and stretch, which is just a cold spray, and doing some stretching for the muscles or the necks, whether it's the jaw or the neck. We always go for a series of 3, meaning I see you once monthly and do the trigger point injections. I never judge trigger point injections by only doing 1 round. I do it in 3 rounds. The idea of doing a trigger point injection is to break the pain cycle that you are having in your muscles. We might do Botox injection, botulinum toxin. I know a lot of patients are doing botulinum toxin injections for their migraines or headaches in general. So we can also do it in this muscle. It's done in 2 to 3 pints. And first of all, we ask the patient to clench to be able to clearly identify the muscle where we want to inject. And we usually go to inject in the posterior inferior border, not to affect the smile, because if it's injected a little bit further upward, it can affect the smile. We need sometimes to also inject in the deep muscle, like the one we just talked. We have to go deep enough not to affect the salivary gland that's present here. We also use a cold spray with that. Some medications are used with jaw pain, like muscle relaxants, non-steroidal anti-inflammatory. We use it for if there's acute muscle spasm for like 2 weeks, and we can use it as the gel, as we were just talking, the Voltaren gel. We might use steroids, whether it's taken in the form of pills or something else is called iontophoresis. Iontophoresis is done by the physical therapist. As simple as it's just a battery having 2 poles, a positive and a negative, and the medication is inserted in the pole, which is the same as the medication. Meaning, if the medication is positively ionized, we put it in the electrode, which is positive as well. And we know, like poles repel. So once you connect the battery, it starts repelling the medication inside your jaw. The idea here is to have less side effects. Its effects are somehow controversial, but some patients get better with it. You also might need to consult your psychiatrist if needed to adjust your antidepressant dosage. Finally, my takeaway message is that any medication has its side effects. So it's better to know the cause of the headache and try to treat it. Unfortunately, headaches are multifactorial. That's why it's best managed by a multidisciplinary approach, where treating all the aspects of headaches. Headache somehow is like a puzzle. We are trying to combine all the pieces for the patient to get better. And maybe the missing piece is the jaw pain. If you'd like to find a TMJ specialist in your area, I would ask you to look into the American Association of Orofacial Pain member directory. It looks like that. Just type your state and you can find a specialist beside you. Thank you.